More adults over the age of 40 are keeping themselves in great shape and pushing the edge of the athletic envelope even further and further every day. But along with that comes some injuries. Older adults are more prone to sports injuries than young people. So what should you do if you fit in this category? Joining us this morning is Dr. Shane No, an orthopedic surgeon at Rush University Medical Center, and you are in the sports medicine department. So you deal with the professional athletes and the recreational athletes, right?
That's correct.
So you cover both bases, and it's a good thing that more older adults are actually staying active, but there are some things we need to be aware of, right?
That's correct. Yeah, I mean, we in general encourage all of our patients to participate in healthy and active lifestyles. But that might be something different for some patients than others. For example, I see a lot of patients in their 40s, 50s, and 60s who are participating in triathlons. But I see others who go into more sort of sedentary type lifestyles, and I see others who go into like gardening and walking and things like that. And
so it's a big array, huh?
Exactly. And so it's hard to say, like, there's some activities that you can do and some that you can't do. But I think the idea is that we just want you to be healthy, we want you to be active, and enjoy whatever you're doing.
Okay, so where do we begin? What are some prevention tips to avoid injuries?
Well, so if it's been a while since you've done something, you really want to kind of start slow, start gradual, kind of make sure that you're kind of dipping your toes in. You know, you don't want to go into like a group exercise class and do really aggressive type activities right away. And so I think a good way to start is, you know, just general kind of walking type activities. Core exercise is really important, making sure you've got good core strength, and that will allow you and build a foundation to be able to do other activities.
So you gave us some of these tips. You're saying also focus on your proper form and not your speed or repetition, right? Don't
Correct.
get too a little over anxious, huh? And try to be the best immediately.
Exactly, and I think that that's an important point, because what we don't want to do is we don't want you to, you know, go in there and focus in on just hitting a number or doing a certain number of repetitions, but we want you to have good form, because that means that you're using the proper muscles, you're doing the appropriate sorts of activities, and you're not compensating or causing future or more potential injuries.
Okay, and then what is the risk of injuries in this age group? I mean, are you seeing a lot of people in this age group coming in because of injuries? And,
yeah.
And what's the biggest thing they're doing wrong, would you say?
So yes, we are seeing a rise in injuries in all patients. I would say, you know, in particular that sort of 40 to 70 age range. And I think the reason is that sometimes they go into activities too aggressively, and they don't kind of, you know, sort of kind of key warning signs that kind of tell them that they should be either cautioning what they're doing or stop what they're doing. For example, if you have pain, significant sharp pain, that's your body's way of telling you that you're probably causing some subtle injury to the joint or to any particular body part.
So how do you know when to stop?
So other warning signs that I would say, aside from pain, is joint stiffness, joint swelling. If you feel like your joint is kind of giving way, those types of things are kind of signs that you should say, well, maybe I shouldn't be doing those things right now.
Okay.
Other warning signs, such as like soreness or kind of, you know, some discomfort, I think those you can kind of monitor and watch and kind of see what happens. You know, in general, if it kind of gets better after 24 hours, then you're probably okay. But if it has lingering effects that can last, let's say, for several days, and those are reasons to get someone to take a look at you.
So pay attention to your body. Okay, and finally, is there a certain age where you should quit doing the things like the aggressive sports, hockey, maybe football, you know, even bicycling, which is huge now?
Sure. I mean, there's certain sports that I think, you know, contact sports, for example, are probably not a great idea, just because they pose a lot of risk of unknown in terms of just whatever's going to happen. There are other activities that you just want to be smart about. You can play hockey. There's great men's leagues out there, but they're usually non-check, and I think the guys are, you know, somewhat respectful for one another. They're not going to try to cause injury and things like that. But I think that you do want to avoid a lot of impact type activities, a lot of cutting and pivoting, very aggressive type stuff, and maybe transition to more endurance type sports that are less impactful.
Okay, so less impactful, which would make sense, and we kind of really know what those are, don't we?
Yes.
Okay, as far as treatments go, you know, what should people think about if they get to the point where they need to, you know, think about overuse injury treatments and doing something about that?
So for overuse treatments, these can last a couple of weeks or so. Ice, compression, elevation, and rest are kind of the key, what we call RICE. And so that usually is a good strategy for any sort of initial injury that you might experience. If it does linger longer than that, let's say 4 to 6 weeks or so, then we're thinking that maybe it could be a bursitis or a tendinitis type injury, or possibly even a tendon tear. And so those are things that we're always kind of cautious about. And so that if it starts to last for, let's say, a couple of months or so, those are reasons to, let's say, have someone take a look at you.
Okay, RICE. I like that. That's easy to remember, right?
Correct.
Okay. Thanks so much for coming in. I think some great tips for our weekend warriors, our recreational athletes, as you were saying, to think about before they go back out there and do what they're doing. But keep up the exercise, right?
Exactly. Keep up the activity. That's important.
Okay, thanks so much.